this. So as I was saying, you will receive a link to this recorded session if you want to share the PDF of the slides and the recording with your friends and colleagues throughout your region and state and nation. You're welcome to do that. And you'll also receive, thirdly, a certificate for 1 hour CEU. So let's go ahead and dive into this topic of monitoring and evaluating prevention plus wellness programs. There's 4 objectives for today's session, and you can see them here on your slide. We're going to be able to identify purposes for monitoring and evaluating prevention programs. So we're going to answer the question, why do we bother with evaluation? What's the need for evaluation, and what purposes does it serve? Secondly, we're going to be describing measurement tools and actual measures for assessing prevention plus wellness programs, their quality, their fidelity, and their outcomes or efficacy or effectiveness, if you will. Thirdly, we're going to examine evaluation designs for determining risk and protective factor, as well as behavioral effects of prevention programs and the ones that we provide. And these designs can be used for any evaluation of any prevention program. And lastly, we're going to explore some case studies of based on evaluation data from a previous PPW, that's Prevention Plus Wellness Program implementation. So we're going to cover all of this today with you during our time together. Let's start out with the purpose for monitoring and evaluating, just globally or generally, I should say, prevention programs, whether the Prevention Plus Wellness programs, some other evidence-based prevention program, a non-evidence-based prevention program, if you wanted to go there, or any other intervention or treatment. And here's particularly today, we're focusing on prevention. So why prevention? Why evaluate? Well, number one, tracking the quality and the fidelity of program implementation is absolutely critical. And by tracking, I mean keeping an eye on, monitoring, watching over. And across time and across program implementers, your quality of program implementation can vary. So you want to keep an eye on it. You want to keep your implementation quality high. You want to make sure you're implementing your program with fidelity. Fidelity, that means, from our perspective, implementing it as it's designed to be, as it's required in some cases, as the developers have recommended or required, or guidelines for implementation. The further away you get from that fidelity, that implementation guidelines, the more likely you're going to build in some error or some issues that can impact the outcomes of your program in a positive or negative way. So, but of course, we're most interested in a negative way. So that's why fidelity becomes a very important issue, especially with evidence-based programs. It's like taking an aspirin. It's like taking an aspirin. Aspirins, we do know aspirins are effective for pain relief. Aspirins have been around for centuries. An aspirin, salicylic acid, has been around for centuries. We know it can be effective, but we also know it's effective only when used properly. If it's used inappropriately, if you take too much over time, that can cause negative effects, stomach bleeding, ulcers, etc. And it could be more effective for some people than others. Doses vary. All of these things are an example of how a prevention program should be implemented with regard to how it should be implemented, where, dose, etc. So tracking quality, fidelity, number one. Number two, of course, obviously, we want to assess the outcomes, the efficacy of our program. Is the program providing and resulting in the outcomes that you want? And of course, ultimately, the outcomes we're interested in. Does our program have an impact on preventing the initiation and reducing the use of substance use. And in the case of prevention plus wellness programs, also increasing protective wellness behaviors or addressing these chronic disease risk behaviors and these risk behaviors that are also associated with mental health. That's again, physical activity, breakfast, nutrition, sleep, stress control, et cetera. So we want to assess whether your prevention program or your prevention plus wellness program is achieving the desired outcomes. That's 2. Number 3, providing data for making decisions about improving your program. Even if you're using an evidence-based program like prevention plus wellness programs, which use an evidence-based screening and brief intervention practices model. And 2 of our programs are evidence-based, in particular sport PPW for youth, in-shape PPW for young adults. And our other programs are what we call evidence-informed. They're based on evidence-based models, but they haven't been individually evaluated. Nonetheless, providing data for these programs, even if they're evidence-based, really important because there's different settings, there's different implementers, there's different youth, different time frame. All of these things add, variation to the to the situation and to the circumstances. So that can influence, hinder, or enhance any particular kind of an intervention. Of course, we're most concerned about whether an intervention is the quality is weakened over time because of situation. So having the data to ensure that your program is producing what you want, very, very important. So that's number 3. You need to have data to make decisions about improving that program over time. And you're not going to be implementing it, and it's not going to be perfect every time, and may not even be perfect the first time. But when you do, and if you collect the data, you'll have that information from which to continue to enhance your program over time and to make sure the quality of your program doesn't weaken or deteriorate over time. And so data, very important for that. So that's monitoring and decisions for increasing and maintaining the quality of your program. Number 4, collecting feedback to promote your program, having data to say to other participating youth and young adults, to parents, to schools and other providers, to communities, to the media, to funding agencies that, hey, look at what we're doing, and to promote and to market, if you will, your program. Very, very important. You need to have data. And that's why we continue to highlight the importance of monitoring and evaluating your prevention programs, including especially PPW programs. Lastly, to contribute to the research and the evidence base in the prevention field. Now, normally providers, prevention specialists, and health specialists wouldn't think about that, but yes, you are informally and sometimes even formally if your data is shared with others in the field, social media, on our website, if it ends up in a written report, if it ends up being published in a refereed scientific journal, all of that is promoting to the evidence base in our field of prevention. So really, really important, all of these critical reasons for monitoring and evaluating your prevention programs and efforts, whether they be PPW, that's prevention plus wellness, or some other program. Let's look at the measurement tool. And by the way, let me just say, because of these, we feel very strongly and have integrated and built in to all of our programs, all of our prevention plus wellness programs, free measurement tools, measures, and even assistance and data with your, evaluation of your program. So we believe in it. We know it's critical. You want to know how well things are going and how to promote your program. We want to learn from your efforts and share your successes with others. That's why evaluation is so important to us. And I think it should be, and I'm sure it is for many of you, if not most of you as well. So PPW program measurement tools and measures. So we have 3 in particular. One, we offer a pre-test and post-test survey. This is to assess the effectiveness of the program or the outcomes. There's actually 2 types of surveys we offer. One is a risk and protective factor assessment survey that can be provided immediately before and after the lesson. And we constructed it such so that it's practical, and it's almost like if you don't do it, I mean, you're missing out, because we built it in so that it's actually can be part of your program. Pre-test, launch your program, complete your program lesson, post-test, all in one setting. There's no reason for you not to do at least that risk and protective factor pre and post survey to help you monitor and evaluate your program. But we also have a second pre-post test, and that is a health behavior pre-post test that actually assesses effectiveness of your prevention plus wellness program, not just on preventing, reducing substance use across a range of different substances, alcohol, marijuana, opioids, et cetera, e-cigarettes, but also promotion of protective wellness behaviors. We'll go through all of that today with you. So that's pre-test, post-test surveys. That's what we offer. We'll show you those surveys. We'll show you those measures today. Secondly, in the Instructor Survey, that's an awesome tool to a process measure to help you assess and monitor and maintain the quality of your implementation across time of your program, across your program implementers. If you got 5 people implementing, excuse me, a program, you can look at all the quality of implementation of all 5 implementers, across, weeks and months and years if you want to. Really, really important, because you want to maintain the quality of implementation, which quite frankly can change given circumstances and environments and time and so forth. So this is a tool to collect data on that. And this tool is a self-assessment tool, but it can also be used as an observational tool by a manager or supervisor. More about that in a minute. Then lastly, Fidelity Checklist. So this is an assessment of, how well are you implementing your program based on the requirements, the guidelines, especially I would almost emphasize requirements, because if you follow these requirements, your program will be implemented with the greatest chances, the greatest likelihood of success for your program. And that's what you want. You want success, you want outcomes, you want your kids to enjoy the program, you want to have fun implementing it, but most of all, you want to see the behavioral change, which is critical. You want to see risk and protective factor changes first, that's immediate change, but then you want to see longer term behavior changes as well. And fidelity, it starts right there. If you're not implementing your program as it's designed to be implemented, if you're taking a half of a dose of aspirin instead of a full dose as recommended, that can really have an impact on the quality of your program. Let's start with looking at the pre-test, post-test survey, the immediate risk and protective factor survey. This is the one that we created that's available to you, as you can see right here on this slide, both in online versions and in paper versions. So there's no excuse really not to use this, almost no excuse, because you can implement this before your PPW program lesson. Most PPW programs, for those that don't know, that may not know this, are single session interventions. So within that lesson, you could implement your pre-test, launch and complete your lesson, implement your post-test, all fits within that framework. You could even do that within a 45-minute period, depending on which PPW program you're using. But that's why we created this measure, so that you as the prevention specialist can find out, maybe even for the first time, how well you're doing with your youth, with your program implementation. It's that focused, and it's very, very helpful to get that feedback. And the reality is prevention specialists don't usually get that feedback. In treatment, it's different. You can see whether someone is abstaining from a substance, quit using a substance, less problems in their life. You could see those literally, those effects. But if you're successful in prevention, what do you see? You don't see anything because you've prevented it. You've prevented the onset of substance use. You prevented the onset of negative physical or mental outcomes. So this is a tool to assess actual things that you can see, and this has really been lacking. And this supports the efforts of prevention specialists. So we believe it's just critical to have prevention specialists have this data to see how well they're doing. So we have, again, step back. This is the risk protective factor survey pre-post test. It's on online and paper versions, so you can use either. It includes 3 risk and protective factor measures, which I'll explain and describe to you today. There's 5 substance use measures, related measures: alcohol, tobacco, e-cigarettes, marijuana, and opioids. There's 6 measures of behavioral, of health-related behaviors, physical activity, 2 measures of nutrition, both breakfast, healthy breakfast, and fruits and vegetable consumption is the latest version of our measures, sleep, stress control, and goal setting. And then also the post-test has 2 qualitative measures, 2 open-ended measures, which are essential because those open-ended measures are, when the youth, participating youth or young adults write into those spaces, that helps to better inform and understand the quantitative data on substance use and health behavior measures. So qualitative, quantitative, you've got a mixed methods approach. It's the best approach for understanding outcomes. And this is our immediate pre-post risk protective factor survey. Let's take a look at the actual survey in more depth so you can understand a little bit more better. So these are the measures, the demographic measures, or introductory measures. You have a date, today's date, you got a code number. Now we've changed that just recently so that the youth or young adult can self-generate their own code. This is particularly important if you're using the online version of the survey. And then you can, if you wanted to, you can pair up the pre-test and the post-test using that code. If you're using the paper version of the pre-test and post-test, well, you'll be collecting those at the end of your lesson from each youth or young adult, putting the pre-test and post-test together, and you don't need a code because they're physically linked, if you will. So and that's how the data will be entered. So if you're, we've added that code, and that code I think is helpful. But even if they didn't have a code, you'll be able to look at the pre-test data independently and the post-test data independently. Also included are a school/location code. This is optional. So if you had, let's say, 4 different settings or locations or schools, you could come up with a code like one school could be 0001, another 0002, and that way you could actually look at your data complete and then subsets of data by a school or location, which could be very informative and helpful for you to understand how things are going. The 2 demographic items are gender and age. And by the way, as far as completion time, 5 minutes for the pre-test, 7 minutes for the post-test, and 2 extra minutes for the post-test because of those 2 open-ended items. So we're talking about a 12-minute data collection period. And so it takes up very little time and gives you most of your time to implement your prevention lesson. So demographics. Now let's take a look at behavioral intentions. This is a risk and protective factor measure. Because your immediate pre-post surveys are assessing risk protective factors, because they're immediate pre-post with, before the lesson and after lesson, and you're not following up a week later, a month later, a year later. Because of that, you can't measure behaviors. But what you can measure are indicators or predictors of behavior. And the number one best predictor, according to research, of future behaviors is behavioral intentions. So you have in this pre-post survey, you've got 5 substance use behavioral intentions measures and 6 healthy behavioral intention measures. All of them are on a 5-point scale of very likely to very unlikely. And just to give you 2 quick examples, one example of is in the next year, how likely are you to get physical activity most days a week? That's a behavioral intention measure of a healthy behavior. And the next one in the next year, how likely are you to take a drink of alcohol, is obviously a measure of a substance use behavioral intention measure. And so you're going to measure these before the lesson and immediately after the lesson. And so what you'll be looking for is, does your lesson, your PPW lesson, the way you've implemented it to your youth, does it increase intentions for the healthy behaviors like physical activity, sleep, eating breakfast, etc.? And is it reducing intentions to use substances, alcohol, cigarettes, e-cigarettes, opioids, etc.? That's what you'll be measuring. 5 substance use behavioral intentions, 6 healthy behavioral intentions measures. And you collect that before and after the lesson, identical measures. So that's behavioral intentions. And so that's why it's called risk and protective factors, because the risk factors are behavioral intentions to use substances. The protective factors are behavioral intentions to engage in these healthy behaviors, which are shown to prevent chronic disease and to improve mental health outcomes. The second risk measure, I should say, risk factor measure that is on the pre-post survey is perceived harmfulness. So perceived harmfulness has been a measure for years in the Youth Risk Behavior Survey, annual survey, national survey. And we know that as youth and young adults perceive a substance like, let's say, marijuana as harmful, they're less likely to use it. So we want to increase perceived harmfulness. That will decrease substance use. So what you've got here is a measure of 5 substance use behaviors, harmfulness measure, 5-point scale of a great deal to not at all. And there's a sample question for you. If you were to use marijuana often, would it harm your health or healthy habits? Now, the Prevention Plus Wellness programs address this content directly in the lessons, whether it's the sport PPW program, which addresses alcohol primarily, the marijuana PPW, which obviously addresses cannabis, vaping PPW, which addresses e-cigarettes, opioid PPW, which addresses opioids, et cetera. You can see you get different PPW programs that address different perceptions. But notice that for all of these programs, we have this survey, which is not just going to measure one substance, but 5 substances. So we are casting a broad net in our measurement of risk factors. In this case, the risk factor is perceived harmfulness. If you don't see a substance as harmful, that's a problem. They're much more likely to be using or going to use it. Social norms is the third and last risk factor measured in this pre-post survey. It's just 3 measures, so it's very quick. As you know, 5 minutes for the pre-test, 7 minutes for the post-test, 12 minutes total. So social norms. This is there's a couple of different types of social norms: injunctive norms, descriptive norms. This is a descriptive norm. This is the type of norm which has been shown to be most predictive of substance use among youth. So 5 substances, again measured: alcohol, cigarettes, marijuana, e-cigarettes, opioids. 5-point scale of all to none. And the question is, how many people your age currently vape e-cigarettes, use marijuana, drink alcohol, et cetera? So we're looking at this descriptive norm of the perception that youth have of the number of their peers, same age peers, that are using a substance. the research shows that this is most likely being overestimated, and that unfortunately ends up giving youth, if you will, permission to use and increases the probability of them using. So what you want to do is you want to assess social norms before and after the lesson, and that's what you're able to do with your PPW risk and protective factor pre-test and post-test survey. So you can see if your program lesson and the way you presented it to your youth in your situation is actually reducing the perception from before the lesson to after the lesson, reducing the perception of the number of the peers that are using each of these substances. Again, we're casting a broad net, measuring not just one substance, but 5 behavioral substances. Also, your post-test, very important, 2 qualitative items. What did you like best about this lesson? And then secondly, what did you like least? Now, the first measure, what did you like best? This is so important. You want youth and young adults participating to write as much as possible. And this content, what did you like best, will give you data and feedback, testimonials, if you will, that you can cut and paste and share with other youth, parents, providers, funding agency, et cetera, about how well you did with your program and your youth in your setting, because youth will write about how this has motivated them, help them avoid substance use, help them increase protective behaviors, improve their self-esteem, et cetera. So it's going to be great stuff. It is great stuff. It has been in the past, and it will really make you feel good to see the actual outcomes, in the words of the participating youth and young adults, on how you are having a positive influence on them. And then the second item, what did you like least, will give you some tips and some hints as to how you might improve the program the next time you implement it, if you read those very carefully, those comments that youth write. So, and that's the next time you offer the program, whether it be next semester, next quarter, next year, et cetera. So qualitative data, you want to encourage your youth to complete that post-test and write as much as possible in those 2 open-ended items. And again, you've got the survey, which is both an online version and a paper version. And for the online version, we can give you a customized link or a customized QR code, so that just your data will be separate from everybody else's. So rather than giving you a generic, a link and QR code, we can give your organization a separate one. So if your organization's, ABC prevention, we could do ABC pre-test, ABC post-test, and we could set that up for you, send that to you free without any charge. And that's so that you can evaluate your PPW program online. And all you have to do is share that link or that QR code and show it to your youth before and after the lesson. And they can click on it, or they can point their cameras at it, their devices, their smartphones, their tablets, whatever they're using in that setting, whether it be a school or what have you. And in some cases, I heard that some organizations are loading those within the system, so that that youth can actually access them, through the school system, the pre-test and the post-test. So whatever is easier, and we'll talk about the difference between the online and the paper surveys here in a minute. The second pre-post survey is the health behavior survey. So the health behavior survey measures both health behaviors and risk and protective factors. So you have 2 sets of measures, not just the risk and protective factors, but actually behaviors, actual measures of behaviors, substance use behaviors and wellness behaviors. And here's the measures and the demographics. Again, you got today's date, you've got the self-generated code number, you got the school or location code as an option, gender, age. We've also added a race/ethnicity measure. And the estimated time to complete this survey is 10 minutes for the pre and the post. So it's 10 minutes, we're talking about 20 minutes. And so that's because you're measuring not just the risk and protective factor measures that you saw in the risk protective factor pre-post test, but also the behavioral measures. So here are the 30-day behavior outcome measures in the health behavior survey. A moderate physical activity, vigorous physical activity, eating a healthy breakfast, eating fruits and vegetables, sleep hours, setting fitness and health goals, substance use, alcohol, tobacco, e-cigarettes, cannabis, opioids, and meth use, and then a measure of mental health, feeling sad and hopeless. So these are the additional measures, or the behavioral measures that are found in the health behavior survey, if you choose to use that, versus just the risk and protective factor survey. So these are the behavior measures of the health behavior survey. But then again, the health behavior survey is also measuring the risk and protective factor measures, behavioral intentions, both of the of 6 substance use. We've added methamphetamines to this survey, 6 protective factors or wellness behaviors, as well as perceived harmfulness of the 6 substances and social norms related to the 6 substances. So you got the health behavior measure, the pre-post health behavior measure measures, as the title implies, health behaviors and wellness behaviors, substance use and wellness behaviors, but also risk and protective factors. So you have quite a bit more data with that. So that's comparing and contrasting the risk protective factor pre-post survey and the health behavior pre-post survey. Now let's take a look at the instructor survey. The instructor survey is a process measure and measures the quality with which you implement your PPW program. We recommend everybody who's implementing prevention plus wellness programs to complete an instructor survey at the end of their lesson, and as soon as after as possible. You have a hard copy of it in your program manual and digital download, but we also have an online version if you want that. And so they could just complete it online. We could send you, again, a customized link to that if you want your organization to complete, everybody who's implementing the program to complete the instructor survey. And then you can collect that data to monitor the quality of implementation across implementer, across teacher, and across time, and across setting if you want to. So you've got 7 critical measures here in the instructor survey. This is meant to be, and again, like I said, it's a self-assessment. So it's sort of a self-assessment, and it's also, you know, a goal, if you will. So you can see the measure, the 7 items: level of comfort presenting, which increases over time with practice. Active presentation strategies like good eye contact, voice fluctuations, listening to your participants. Number 3, enthusiasm and passion. So important for PPW programs because these are motivational programs. We are motivating youth to take action, to set goals, to improve their lives. So 3, very important. 4, smoothness, continuous of lesson. 5, accuracy of following the script. All of your PPW programs are scripted, so if you follow the script, it should not be a problem. And the script helps improve and maintain and sustain fidelity of implementation across implementer and across time. Number 6, did you complete the entire lesson? Screening, feedback, goal setting, all in one session. And then lastly, participant responsiveness. So these are measured on a 5-point scale of a great deal to not at all. And of course, the goal is to get to that a great deal. That's why I said that this is, in a sense, not just, it's a self-assessment where how well each individual teacher implementer did implementing that particular lesson, but it's also aspirational because you want to get to a great deal. You want to get to a great deal of active presenting, a great deal of enthusiasm and passion, a great deal of accuracy in following the protocol, etc. Now, the other way to use this tool is to have a manager or supervisor observe a teacher within your organization and use this as an observational form. So you could score that person, watch them practice or watch them implement to a youth or young adult, score it, and then give them that positive feedback. You did good here, you can improve there. That's a really good way to use this tool. So there's two ways to use this instructor survey. One, self-assessment by each instructor after implementing each of their lessons. And then two, as an observational form by a manager or supervisor. Now, in addition to these 7 measures, there's, you could see 4 more others that are optional. Which PPW program did you implement? Since we have a range of programs, and if you wanted to track that, and let's say your organization is implementing sport and vaping PPW and marijuana PPW, then you want that implementer, that teacher, to identify which program they're providing. Okay, and how was it implemented? How was it implemented? So programs can be implemented one-on-one or in a group, in person or online. And so there's a lot of variability there. And then lastly, there's 2 open-ended items in case the instructor wants to elaborate, and think about, what worked best during that presentation and what did they like least about it. And you could document that and monitor that over time. So really a great tool to assess quality of implementation. This is a process measure. This is the instructor survey. And then the third item, of course, again, we've covered pre-post surveys, instructor survey, and now a fidelity checklist. We have included in our programs a fidelity checklist, and there's pre-implementation steps, implementation steps, and post-implementation steps. You can see pre-implementation, getting training so that you can really know how to make the best of your program script, and collecting, practicing the script before you implement it. We recommend at least 3 times aloud, coordinating your script with your slides, and then pre-testing. You want to pre-test your participants before you launch your lesson. Number 2, the actual implementation. You want to follow the script. You want to have lots of enthusiasm when you implement your program. You want to implement all 3 components of your screening and brief intervention within that one setting: screening, feedback, goal setting. You want to use your PPW slides, or your PowerPoint slides, I should say, during your PPW program. You want to read the goal plan aloud with the youth and co-sign it, which will increase motivation for change. That's implementation steps. All of these are fidelity steps. And then lastly, number 3, post-implementation steps: collecting a post-test, completing an instructor survey, completing a fidelity checklist, and then reminding your participants to continue to set goals week after week to improve their long-term improvement over their healthy lifestyle. That's the fidelity checklist. Now let's take a look at evaluation designs. If you choose to use the immediate pre-post survey, which is the risk protective factor survey, you've got 2 models that we recommend. The minimum is demonstrated by the 01x02. 01 refers to pre-test, 02 refers to post-test, X refers to your program implementation. So essentially, if you look at that minimum design, 01, you pre-test, you immediately implement your program, and then you immediately post-test. There's an asterisk there because you can do that immediately before and after lesson. No follow-up is required. That's your minimum design for getting some feedback and some data from which you can continue to improve and promote your program. A better design is the one below that, where you have 2 rows. The first row is the same as the one above: pre-test, implement the program, and post-test. But then you get a second row, which represents another group of youth, where they get a pre-test and a post-test, but no program. So essentially, you've got, in the better design, you got two groups. One group gets a pre-program post, another group gets a pre and a post, and you can compare the two groups. And that's a stronger design, which can give you further what's the word I'm looking for? Confidence that any program outcomes that you see are due to the intervention and not some extraneous variable. So that second group that just gets a pre and a post, it could be a group that's randomized to receive nothing at that time, and then after the post test they can receive the program if you want. That's called a waiting list control. Or they could be just another class or group that, you know, they're receiving anything. Maybe they're in PE, maybe they're in health education, maybe there's, you know, just a group at a YMCA, but you can pre-test them and post-test them, you know, within an hour or so, but they don't get a program, and that's your comparison group. So these two designs, the minimum and the better design, are what you can use, or what you should use when you use your immediate pre-post risk and protective factor survey, whether it be the online version or the paper version. So I think we've seen that most organizations will use this pre and post because it's very convenient. It can be done within the setting. They don't have to do follow-up, and they'll most likely use the minimum. But we do encourage to have that better design. That's even better to have a comparison group. You have two groups. One get the pre-program post, one gets the pre and the post without the program. Now, let's say you're choosing to use really the better survey, which is the health behavior survey, which has health behavior measures and risk and protective factor measures. Now, your design here looks just like the risk and protective factor design, but it isn't. There's a pre-test, there's your program, and there's a post-test, but the difference here is your post-test is not immediately after the lesson. It's 1 or 2 or 3 months after the program. We set that up, by the way, 1 to 3 months, because we know a lot of providers implement these within a school setting. So if you implement this within a semester, you've got plenty of time to implement your program, and to still within that same semester follow up 1 or 2 or 3 months later. Okay, if you wanted to, you can do that and follow up again if you wanted the following semester, but at least one time within 1 to 3 months. So that's the minimum design: pre-test, program, and then your post-test is 1 to 3 months later. That's the minimal design. A better design is just like what we described before: pre-test, program, post-test, and then have a second group who gets the pre-test and post-test, but no intervention. There shouldn't be an X there. That second row, there should be just a pre-test and a post-test. So that's your comparison group. I hope you understand that. So if you don't understand that, let me know. We can discuss that a little bit more. So the first row, 0x, 01x, 02, that's your pre-test, program, and a follow-up. And then the second row should represent a second group of individuals. It should be 01, and then again, a follow-up of 1 to 3 months later, that's 02, but no X, no intervention there. So I got to take that out. That's a little confusing. My apologies, I didn't see that. If you compare online and paper survey, there's different advantages and disadvantages. Look to the left-hand column, the online, you can see advantage of the online survey. We really encourage, to the extent possible, you use the online surveys. Why? No data handling required. It's likely to increase response accuracy because youth are going to feel they're more anonymous and certainly confidential online versus in paper. Quick and easy. And the disadvantage of the online is it does require that youth have a device and internet. So they have to have a tablet, a smartphone, or something. The right-hand column, the paper version advantage is you don't need the technology. You can make copies of your pre and your post test and hand them out. The disadvantage is that it may reduce the accuracy of reporting because you're there, you're handing it out. And so there's going to be what's considered, what's called in the literature, social desirability, to underreport their risk level, for example. Another disadvantage is that you have to collect the data and you have to hand enter the data into a survey link, which we can provide you, but you still have to enter the data. So that takes more work and more time. So here are the 3 easy steps for data collection if you use the online survey. Again, this is preferred because it's quicker, saves you time, more likely to be better data, less errors, etc. So number 1, you display your pretest customized link or QR code. And then after the lesson, you display your post-test link or QR code, and then you request the data from us. We'll send you the, by the way, these links and these QR codes, we use a SurveyMonkey survey. So we'll send you the link to the SurveyMonkey charts. We'll send you the raw data for further analysis. Very, very simple and very quick. If you collect data using the paper surveys, you can see there's 5 steps instead of 3. You have to implement your pre-test prior to the lesson. You implement your post-test after the lesson. You collect your pre and your post-test together and put them in a box or an envelope for later hand entry. Number 4, you enter your data, and we'll give you a SurveyMonkey link to enter the data. And then lastly, you could request the data from us, and we'll send you the SurveyMonkey charts and data. We have some case studies of program effects from the past. Here's one case study of the SPORT, that's our alcohol and drug single session PPW program. This was implemented in Neptune, New Jersey within the last year or 2, virtually implementation, so probably last year during the pandemic. And you could see, and it was a high school implementation and a sample of 33 youth. And you could see some of the outcomes. They're pretty impressive. I think you could see increases in likelihood of youth from pre to post, saying that they'll get, more than half of them saying that they'll be likely to get get physical activity most days a week. That's the behavioral intention. Increased likelihood of eating healthy food, mostly healthy foods, taking action to reduce stress, and also increased likelihood of avoiding illegal drugs. This is from pre to post. So you can see these increases in these behavioral intentions. Perceptions of harmfulness, 76% increased harmfulness of using alcohol, 88% harmfulness of marijuana. So really good outcomes in this particular study. And then from the qualitative data, what did you like best? Look at some of these comments right from youth. It showed how to be more healthy and how to avoid drugs and alcohol. So you could see how those behaviors are being integrated and received by youth. It helped me improve my health because they said a healthy lifestyle can improve my life, including school. So you could see some of the outcomes linking it to beyond health to including even outcomes in performance in school. And it motivated me to eat healthier, become more active. So those are those wellness behaviors. So really good comments from this case study in Neptune, New Jersey of a virtual implementation of sport in a high school setting. Here's another case study of the vaping PPW program. That's our e-cigarette program. This was implemented in Caldwell, Ohio, to a group of 6th and 9th graders, or groups of, I should say, 165, and you can see again positive outcomes here on, almost 100% increase in the likelihood of getting physical activity most days a week, which is amazing. And some of the other perceived harmfulness, et cetera, some great written comments. I'll never use e-cigarettes. I now have a health goal, etc. Really, really good. And I'll send you this so you can read these comments and share these with others. And a third case study, very unique. It's our InShape young adult program. Oh, it's not vaping, by the way. I need to edit that out. It's the InShape, which is alcohol drug PPW program. This was implemented in Spokane, Washington. Group implementation by the U.S. Air Force, young adults. There was a sample of 30, and you could see the pre-post improvements in behavioral intentions among these young men and women in the Air Force in Washington State. Great outcomes in improvements in behavioral intentions, great outcomes in improvements in the perceived harmfulness of substance use, and even, these first two items right here. And then the last items on the bottom are favorable self-efficacy. We had back then a measure of self-efficacy. That is the confidence they could avoid substance use. And you could see, for example, 89% said they were very to somewhat sure they could stay away from using alcohol. So good outcomes there. Sample online survey charts and data. Again, these are SurveyMonkey, just to show you could get these beautiful charts. You also get frequencies and quantity measures, frequencies and percentages of each of these responses. So there's just some samples there of some demographics and some previous measures. You know, how likely are you to drink alcohol? You see very unlikely. And you can see the responses on that 5-point scale, both in terms of frequencies and percentages. And so that's what you'll get from when we send you the link to the SurveyMonkey, and then you'll actually get the raw data for doing further analyses. So in conclusion, there's 4 things here. Number 1, there are essential reasons for monitoring and evaluating substance use programs, especially because you want to track how well you're doing so that you can improve your program and you can promote your program. Secondly, PPW provides online and paper surveys for assessing program quality, fidelity, and outcomes. The preferred online outcome survey measure, health behavior measure, includes measures of behaviors, both substance use and health promoting behaviors, as well as risk and protective factor measures. And this you need to implement before the lesson and then 1 to 3 months after lesson. So that's the best measure. It does require follow-up. And so if you cannot do that, if you can't follow up, then you use the risk and protective factor measure that you implement immediately before and after the lesson. And in the future, we're going to have some, I think, really good new case studies, because we're going to have these additional measures that we've added and updated measures to both our risk and protective factor surveys and our health behavior surveys. So that's it. You can learn more on our website, preventionpluswellness.com. There's links to request program samples to learn more. There's our phone number here in St. Augustine, Florida, 904-472-5022. Email us anytime at info@preventionpluswellness.com. So let's see what the comments are. We need your help in my group in Ghana, and any help I can provide you, I'd love to. I would just tell you, you know, I know Ghana is a very poor place, and most of our programs cost something, training costs something, but we do have one program for free. I just want to tell you about it. It's In God's Image. It's our faith-based program, and you could download the program for nothing, for free. Just go to our website, preventionpluswellness.com, go to programs, and then download that program for free. And then we also have, give you one other hint, we also have free resources. So if you go to our website, preventionpluswellness.com, go to the menu, find resources, click on that, and you'll see a whole bunch of free resources, web-based resources, content, really good stuff there. So I hope that helps you. Let me know if it does, or if you need something else. Good morning from beautiful Panama. Great wealth of information. How can I get my code? So if you want a code, if you want a customized link and QR code, just email me, info at preventionpluswellness.com. And then let me know what you want. Do you want the immediate pre-post survey codes, or do you want the health behavior survey code? And I'll send you the links, and I'll send you the QR code. Let me know what your organization's name is, so I'll use part of that name in the code so that you know that that's your code. So just send that to us, info at preventionpluswellness.com. Okay, I'm just looking to see. Merry Christmas to you all. Happy holidays. Happy New Year. God bless you all for what you do. We will not be having another webinar until the new year. So this is our last webinar. Thank you for joining us. Thank you for all you do for children and families in your part of the world. And do keep us in mind if there's anything we can do to help you both prevent youth substance use and promote these incredibly important protective wellness behaviors that help improve physical and mental well-being of young people. So if we can help in any of those areas, let us know. And we'll be coming back in the new year with working on some new webinars. And of course, we'll update previous webinars as well. So you could find all of that on our website, the list of our webinars. And anyway, so again, thank you. I just want to make sure I didn't miss anybody's comments or questions. A great wealth of information. Thank you so much. And thank you for what you do and all that you do in your area. Let me just double check. Can your pre-post work for another program? That's a good question. It can, if you feel that the questions are appropriate. So for example, as you saw the measures, and we're not just measuring measures of 5 substances, but we're measuring 6 measures of protective wellness behavior. So, I mean, you can use those for other evidence-based and non-evidence-based programs, but the question is, are your programs and efforts addressing that content? So if you are, then certainly I think you can use our, and I'm happy to send it to you. So just let me know, but they're obviously designed to measure broadly substance use or predictors of substance use, as well as predictors of these protective wellness behaviors. So, and that's what's addressed in Prevention Plus Wellness programs. If you feel that that's important and could be something you want to measure in a non-PPW program, just send us a request at info@preventionpluswellness.com, and and the name of your organization, and which survey do you want? Do you want the pre-post risk protective factor survey or the pre-post health behavior survey? Okay, great questions. Many blessings to you all. Happy holidays. Thank you all. Wonderful, wonderful from Cali. Awesome. Thank you guys. You're fantastic. A lot of people in the happy, joyous mood, which is wonderful to see. Take care of yourselves, protect yourselves, and enjoy the holidays. And if you need anything, let me know. Check out our website, preventionpluswellness.com. I will see you all back certainly early next year for those of you that like to attend our webinars. Thanks, everyone. Bye-bye.